Welcome back. Let's get started. NUR 410, week 5, part 2. We're going to get started with maturation effects. Maturation in a research study, is related to changes that occur in subjects over time that do not occur as a result of the intervention or attribute being studied. Subjects can change because of normal aging, personal growth, acquisition of knowledge and skills outside the study variables, or physical changes related to a disease process. For example, when studying the effects of relaxation techniques on the management of pain in patients with bony metastasis, the effects of the techniques will be minimized as the disease worsens. Maturation, a threat to internal validity because the changes that occur in subjects do not happen as a result of the intervention, but rather because time has passed. Maturation is a particular concern in populations that are expected to change over time and in longitudinal studies. For example, populations that include children, individuals with chronic diseases, or the elderly are prone to the effects of maturation, particularly if measures are taken over an extended period of time. Testing effects. The threat of testing is related to the effects of taking a test, then retesting the subject. Subjects can become more proficient at test taking based on repeated experiences. For example, the effects of different types of educational methods on the retention of skills necessary to manage central lines in the intensive care unit could be measured with a knowledge test. If the test was administered immediately following the instruction and then repeated within 2 weeks, results may indicate there is no difference in the retention of knowledge and skills based on the educational method. The results may be due to having seen the test before, rather than the effects of teaching method. One method to reduce the risk of this threat is to schedule the retesting at longer intervals or retest subjects using a different test. Instrumentation effects. Instrumentation effects may occur because the instrument or data collection device has changed in some way. This can also be a threat when the data are collected by multiple individuals. In a study designed to determine if 3-year-old males exhibit aggressive behavior more frequently than 3-year-old females in a play group, the observer needed to use specific criteria to score or count aggressive behaviors. If observer number 1 scores any physical contact as aggressive, but observer number 2 considers only hitting and kicking to qualify as aggressive, the resulting data will not be valid. This threat can be reduced by training the observers carefully using very specific protocols and test inter-rater reliability. Instrumentation, a threat to internal validity because the instrument or data collection procedure has changed in some way. Treatment effects. Subjects may react to the treatment itself, even if it does not exert a therapeutic effect, also called the placebo effect. The treatment itself may elicit a response that cannot be differentiated from a physiological response. This threat to internal validity is a primary reason for the use of randomly assigned control groups and comparison groups. Placebo effect, a threat to internal validity because subjects may perform differently when they are aware that they are in a study or as a reaction of being treated. Sometimes subjects in a study may perform differently because they know they are in a study. In such case, changes occur in the subjects not because of the intervention, but rather because the subjects behave differently than they would normally A phenomenon is also referred to as the Hawthorne effect. Changes occur in all groups, even those that do not receive the treatment or intervention. Consider an intervention designed to increase self-efficiency in patients who receive chemotherapy. All subjects were recruited into the study and randomized into either the intervention group or the control group. A pre-test measure of self-efficiency was determined to all subjects. All the subjects met with the researcher. However, the control group received written literature about chemotherapy, and the experimental group received a focused, structured intervention designed to increase self-efficiency. The post-test revealed that the subjects in both the control and experimental groups demonstrated a statistically significant increase in self-efficiency, which could have simply been related to the subject's awareness of being in the study. The Hawthorne effect is of great concern if the researcher is in a position of perceived authority, as in leadership studies or when physicians lead research teams, so that the subjects act in a way they perceive as desirable. Because of the ethical concerns, it is difficult to control for this threat. Subjects need to be informed that they are in a study. However, it is possible with the Institutional Review Board, IRB approval, to inform subjects that they are in a study, but to be less explicit about what is being studied. In a study to determine the correlation among suffering, self-transcendence, and social support in women with breast cancer, for example, the instrument used to measure suffering was called the Life Experience Index rather than the measure of suffering. The concern that was that calling it suffering might influence the responses. Multiple treatment effects. When multiple treatment effects are being applied at the same time, it is difficult to determine how well each of these treatments work individually. Perhaps it is the combination of treatment that is effective. Another concern is the effect of the order in which the treatments or interventions are being administered. This concern about the sequence of events is particularly worrisome in interventional studies, where confirmation that the independent variable precedes the dependent one is important. For example, a researcher may study the effects of a skin cream applied manually to prevent skin breakdown. The cream is applied using a circular massage. Patients receiving the treatment may have a lower pressure ulcer rate than patients who do not. However, the difference may be due to the act of massaging the area and not simply the application of the cream. Multiple treatment effects threaten the validity because they make it impossible to determine the unique contribution of each treatment to the outcome. Selection effects. Subject selection refers to the biases that may result in the selection of assignment or subjects to groups in a way that is not objective and equitable. Selection effects can be exerted by the researcher through sampling strategy or by subjects during the recruitment period. The more specialized the population under study, the more difficult it may be to recruit a representative pool of subjects. In a study to compare two smoking cessation treatment programs, if Group A has 40 females and 10 males, and Group B has 56 males and 4 females, there may be gender differences in response to treatment programs. Randomization or random assignment to study groups counters this threat. Subject selection, a threat to internal validity due to the introduction of bias through selection or composition of comparison groups. Attrition. Attrition refers to as a loss of subjects during a study. For example, a longitudinal study to examine the effects of different types of exercise on weight loss began with 100 subjects, but ended with only 44. Those who stayed in the study may have been more motivated to exercise, or they may have been more physically active before participating in the project. Attrition, ATTRITION, a threat to internal validity resulting from loss of subjects during a study. Some subjects could have moved, became ill or injured, or been able to continue the study for a host of other reasons. Some attrition is expected in any study. This type of risk becomes a concern. However, when the validity is affected, such as when attrition is excessive or when the loss of subjects is systematic, the risk can be avoided by taking the following steps. Advising subjects on the time commitment in advance. Screening participants who might be likely to drop out of the study. Those who have no computer, for example. Making it convenient to continue participating. Technology-supported visit reminders, and upfront scheduling. If and when the subjects do leave the study, the researcher should determine the reason for their exit. An analysis and discussion of the reasons of attrition can help the researcher determine if the systematic sampling error will result from the loss from the subject pool. For example, if all the individuals who leave the study do so because their illness worsens, then the study will be left with only the subjects who are less ill, so its internal validity will be compromised. Factors that jeopardize external validity. External validity refers to the generalizability of the findings of the research to other settings or other populations. The researcher should ask, can these findings be applied to other people or other settings? For example, a study exploring the relationship of smoking to physical activity might not obtain the same results with a group of rural adolescents as with a group of adolescents from an urban setting. Population validity refers to generalizing the findings from the sample to a larger group or population. For example, population validity is present if a study conducted on adults can be generalized to adolescents. If the sample is drawn from an accessible population rather than target population, however, generalizing the research results from the accessible population to the target population is risky. If the study is an experiment, then potentially different results might be found with subjects of different ages, ethnicities, or genders. A study of the effects of a support group on suffering in a population of women with breast cancer, for example, might reveal that the subjects who attend support groups report lower levels of suffering, yet those findings might not be applicable to a population of males or even other females who are suffering due to causes other than breast cancer. Population validity. The capacity to confidently generalize the results of a study from one group of subjects to another population group. The extent to which the results of an experiment can be generalized from a set of environmental conditions created by the researcher to other environmental conditions is sometimes called the ecological validity. This issue is a concern with experiments or interventional studies. Is the setting in which the study was conducted similar to or different from other settings? The setting may differ in terms of its geographic location, population characteristics, or level of care. For example, a study completed in an intensive care unit may not be generalizable to a rehabilitation unit. Both population and ecological validity are important considerations when appraising research as evidence for nursing practice. The nurse must determine if the results are appropriate for application to a specific setting and group. This requires consideration of the effect of threats to external validity and to the extent to which they are controlled. Selection effects. As could be surmised, the selection of subjects is the process that will most affect external validity. External validity is enhanced when subjects represent the population closely, so using a strong sampling strategy will enhance external validity. It may be possible, however, to gain access to a broad representation of the entire population. For example, what if a researcher studying the effects of early ambulation on nausea can recruit subjects from only a limited geographic area? The effects of the location, setting, and types of patients who are accessible will affect the breadth of the generalizability of the results. The way the sample is selected then is a primary consideration in the evaluation of evidence for application to a specific practice. Time and historical effects. Researchers should be cautious when transferring results obtained during one time period to a different time period. The conditions for the two periods could be quite different. For example, the results of an intervention to teach new mothers how to feed a newborn in 1995 will not apply in 2014. The length of the hospital stay has been greatly reduced, and the amount of teaching time available may make the teaching method used in older study ineffective. Another threat to external validity is the amounts of time it takes for an intervention or treatment to take effect. It is possible that the effects of the treatment or intervention might not become evident until weeks after the intervention is administered. In such a case, a post-test conducted immediately after an intervention might show no significant changes in the subjects. By comparison, if testing is done 3 months, significant changes may be detected. For example, suppose an exercise intervention was introduced to a sample of seniors. Quality of life testing was conducted after 2 weeks of the exercise program, but did not reveal any significant improvement in reported quality of life. However, when the same subjects were tested 60 days after continued participation in the exercise program, their self-reported quality of life was significantly higher. Novelty effect. Pink water bottle. What is the substance in my pink water bottle? Stay tuned to find out. Okay. So week 5 also has a midterm. Stay tuned. Novelty effect. It is possible for subjects to react to something simply because it is unique or new. The treatment or intervention does not cause a change in such a case, but the subjects respond to the novelty. In a study to determine if online synchronous chat rooms were productive for clinical post-conferences, the initial posts of the students were very positive in only a few weeks. However, the attendance and response dropped dramatically. Conversely, it is possible that subjects will not change because the intervention is too new, but they will adjust to it over time. In the same project, using asynchronous discussion groups was unsuccessful at the start of the project, but as times passed, students adjusted to this method of conferencing and participation increased significantly in both quantity and quality. Experimenter effect. Okay, it is also possible for subjects to react to the experimenter or researcher, such that the results could be very different if another individual conducts the study or applies the intervention. In a study on sexual behavior of middle-aged adolescents, for example, the response rate was about 25%. The researcher was a middle-aged Caucasian female. The subjects were 15 to 17-year-old African American males in a high school in a major urban area. The surveys were incomplete and the responses appeared to be random. When the same survey was administered by a 22-year-old African American male, the response rate was 88%. The surveys were completed and the responses were appropriate. Experimenter effects pose a threat to external validity because the intervention may be effective only when applied by a particular kind of individual. Experimenter effect, a threat to external validity due to the reaction when the researcher conducting the study or applying the intervention. Balancing internal and external validity. If the researcher's obligation to design and carry out studies in a way that maximizes both internal and external validity, however, just as the risks of type 1 and type 2 errors must be balanced, so the researcher is also challenged to find ways to control each type of validity without compromising either one. The paradoxical relationship between the two types of validity makes this a formidable task. Internal validity is supported by systemic, objective procedures carried out on randomly selective, large samples in tightly controlled settings. A review of the characteristics described in the previous sentence makes it clear that the more internal validity is controlled, the more artificial the study becomes. The artificiality limits external validity or generalizability. Nurse researchers function in applied settings with subjects who do not often behave in prescribed ways, and care is rarely delivered in laboratory settings. Finding a balance of control and usefulness is a constant challenge for creating research as evidence for nursing practice. Trustworthiness in qualitative research. Many research questions are best answered using a qualitative approach. The intent of the qualitative research is to interpret rather than to test interventions. Qualitative research is sample specific and is not intended for generalization. The concern for internal and external validity then is not as paramount in the design of qualitative research. Qualitative researchers are still concerned with representing reality accurately in searching for truth, so generating confidence in the researcher's conclusions is still important. That is, where the simple comparisons end, however, qualitative researchers use different terminology, and there is disagreement among researchers about the concept of validity in qualitative research. Some believe validity is not compatible with the philosophy of qualitative research, whereas others argue that efforts to produce validity increase the credibility of the findings. The controversy focuses on the inherent bias in qualitative research, and searches for other means to ensure the results can be trusted. Piera, 2012, suggests that new standards for evaluating validity are needed in qualitative research. She suggests a combination of addressing both the strength of the methods and the quality of the research experience. The terms plausible, believable, and trustworthy are generally used when discussing the validity of findings in qualitative studies. These terms reflect the premise that the findings can be defended when challenged. Some threats to the validity of quantitative studies jeopardize qualitative studies as well. The Hawthorne effect, selection effects, and historical effects may affect subjects in both types of studies. Nevertheless, some unique factors must be considered when judging the appropriateness of qualitative findings. Although generalization is not a goal of qualitative research, the applicability and transferability of the findings is of great interest as evidence for practice. The researcher should provide an explicit description of the sample and setting so the reader can decide if this research can be applied to other samples. There is no test of significance in qualitative research. The in-depth description of the characteristics of the subject sample being studied may allow one to conclude the extent to which it is comparable to other subjects and samples. If the subjects and samples are comparable, then one would be more comfortable transferring the results to other people or other places. If it can't be argued that what is being observed does not depend on the context or setting, then it might be transferred to other contexts. The conclusion enables a nurse to use the results as evidence in dissimilar settings with more confidence. Applicability and transferability. The feasibility of applying qualitative research finding to other samples and other settings. Replicability enhances the trustworthiness of the results. The credibility of qualitative studies is supported if the findings are confirmed by others, much like any other kind of research. However, this is not a simple process. Replicating a qualitative study is very difficult to accomplish because of the original study is conducted in the natural setting, which will invariably change if carried out with other populations or in other places. An attempt at replication should be accompanied by a thorough discussion of the similarities and discrepancies between the two study settings and populations. Replicability, the likelihood that qualitative research outcomes or events will happen again given the same circumstances. The qualitative researcher can take specific action to enhance the trustworthiness of results and conclusions. A thoughtful consideration of potential threats to credibility can help the researcher plan reasonable methods to minimize their effects. Strategies to promote the validity of qualitative research. Just as threats to validity must be considered and dealt with in a quantitative design, so factors that may jeopardize the credibility of qualitative studies should be recognized and addressed. Qualitative research design is usually an emergent process. However, so many decisions are made as the study unfolds that will strengthen the reader's confidence in the findings. Certain characteristics are shared by all strong qualitative studies, regardless of the specific type of qualitative design. Prolonged or varied field experience. Whenever possible, qualitative researchers should collect data over an extended period of time to allow the researcher to get an accurate picture of the phenomenon being studied. For example, a A study examining the work environment in a critical care unit should account for the fact that the atmosphere may vary day to day and over the course of a 24-hour period, as well as from nurse to nurse. Interviews to understand the experience of working in critical care should be done at many different times on different days and with different nurses to capture these variation. Verbatim accounts. Qualitative researchers should be careful to keep accurate field notes and to report results as direct quotes to avoid making inferences. Descriptions should be close as possible to the participants' accounts. This ensures that the meaning that is captured is the respondent's, not the researcher's interpretation of it. Triangulation. Triangulation is the researcher's use of multiple sources to confirm a finding. In other words, isolated incidents and perceptions should not be the basis for drawing conclusions, but rather patterns of responses that appear frequently. To meet this criterion, the themes will be identified in the words of several respondents are identified in multiple ways, for example, words, documents, and observations. Cross-checking information and conclusions using multiple data sources to increase understanding, use of multiple research methods to study a phenomenon, and the use of multiple researchers can increase the credibility of the results. Triangulation. Cross-checking and conclusions using multiple data sources, methods, or researchers to study the phenomenon. Participant feedback or member checking. The procedure for participant feedback is also called member checking that involves discussing interpretations and inclusions with the participants. Checking the accuracy of the observations directly with subjects ensures that the researcher's interpretations and observations reflect what the participants actually meant. This step is essential to determine that the researcher has captured the real meaning of the data and has not interjected bias into the conclusions. Member checking. Checking the accuracy of the observations and conclusions directly with subjects. Bracketing the researcher's bias. Qualitative researchers are less concerned with bias than quantitative researchers are. Research conducted in an interpretive manner in a natural setting has inherent bias that is expected and accepted in qualitative research as long as it is not careless or excessive. However, the researcher should still critically examine personal biases and inclinations that might affect interpretation of the data. Bracketing is a strategy used to control bias. A researcher who is aware of his or her own biases and makes them explicit is less likely to succumb to them. In other words, the effects of the bias are put in brackets so that they can be set aside. The researcher should also bracket any presumed knowledge about a subject or topic during data collection and data analysis. The researcher needs to be open to ways in which gender, age, ethnicity, religion, politics, and other factors might affect the interview, observations, or participation in the project. A qualitative study by nature is unlikely to be 100% objective. However, efforts should be made to convince readers that a high level of objectivity has been maintained. Bracketing. The process of explicitly reflecting on and documenting the researcher's biases. Documentation of an audit trail. Documentation in qualitative research includes field notes and reports, interpretations, and thorough description and reports of feedback. Careful records must be kept of each of these sources of information. In addition, the emergent nature of the design requires constant decision-making with a record of the rationale for each choice. This record of data and decisions constitutes an audit trail that allows the researcher to describe procedures and defend the results. A conscientious audit trail can also aid in replication of the research in other settings or other populations. Records should be accurate, thorough, and complete. Strategies to ensure that these standards are met include writing early and often, including primary data in the final report, using rich descriptions, and getting frequent feedback on the documentation. Reading a research study to determine validity. Unfortunately, there is no section of a research report labeled validity. Instead, the reader must evaluate the validity of the design and determine whether the results obtained are believable. Nevertheless, it is possible to analyze a report in a systematic manner to determine which potential threats to validity exist, what the researcher did to control the threats, and finally, whether these efforts were successful. Two places where the reader can find information about the primary controls for validity are in the Methods and Procedures section, where sampling, measurement, and analysis are described. The way samples are selected, responses are measured, and the data are managed can all inhibit or enhance validity. Most authors will describe the factors that jeopardize validity from their point of view. This description is usually found in the discussion or conclusion sections, but it may be in a separate section labeled Strengths and Limitations. This list not be all-inclusive and is often subjective. Ultimately, it is the reader's obligation to determine whether the results apply to their patients and setting. Some studies will have very few threats that affect them. Others will have multiple threats. There is no magic number or of acceptable threats. Some threats are also more important or having more damaging effects than others. Replication of studies compensates for threats to internal validity. Studies that have been replicated many times with similar results have the highest level of validity and therefore constitute very strong evidence for practice. Studies that aggregate and review multiple studies, such as meta-analysis, systematic reviews, and integrated reviews, compensate for many threats to internal validity and form the strongest evidence for practice. Determining whether the researcher has controlled threats to validity can be a matter of judgment. Validity is an inexact concept that involves balancing controls with the risk of making errors. Achieving this balance is demanding, so weaknesses are inevitably discovered when a study is scrutinized. Because validity is one of the key characteristics of a study that makes it strong evidence for practice, however, a critical eye is required. Internal validity instills confidence that an intervention will produce an effect. external validity, it can be used for the greater good. Trustworthiness means findings can be applied to broader groups, all critical as evidence for effective nursing practice. Using valid studies as evidence for nursing practice. For all those that continued watching, I am drinking water. 40 minutes and 26 seconds in. So if you stuck around, well done. No extra points. Just let me know that you stuck it out with me. Because, whoa, this is long, and we're still not done. Okay. Determining whether the results reported in a research study can or should be applied to nursing practice involves careful consideration of the validity of the study. If a study is not valid, then the results that were reported cannot reasonably be expected to occur in every setting. Many questions can be asked to determine if the independent variable actually caused or affected the desired outcome. Even when that answer is yes, the nurse still must determine if the results are applicable to a specific population. The first order of critical analysis should be a systematic review of internal validity in a quantitative study or of credibility in a qualitative one. If a study has poor internal validity, then external validity cannot be achieved. Using a systematic approach, the study is reviewed for threats to internal validity and their effective controls. If a study is determined to have acceptable internal reliability, then a careful consideration of external validity should precede recommendations. The type of population and the setting should be carefully reviewed and applicability to a specific practice setting evaluated. For example, suppose an intervention designed to reduce the incidence of falls is implemented in a long-term care facility. Fall data are carefully documented before and after the intervention. The data reveals a statistically significant decline in falls on a study unit. However, the patient age and level of infirmity were reduced at the time, and the number of unlicensed assisted personnel was increased. The threat to the validity of the study is obvious. A multiple treatment effect makes it possible to determine which intervention had the result. Were patients less likely to fall because they were not as sick? Were more UAPs available to provide assistance? Or was the intervention alone responsible for the change? The threats to validity in this study means its application to practice is limited until the study is replicated under more controlled circumstances. If the study findings are indeed replicated several times, the nurse must still determine if the population and setting are similar enough to apply the findings to practice. The fall study, conducted in a long-term care facility, may not apply to a medical surgical unit. Results that were generated from a population of infirm elderly patients in a nursing home may not apply to outpatient surgical patients. Even studies that are internally valid and replicated may not be useful as evidence if the population and settings are so specific that the results have limited applicability. Considering the internal and external validity of studies is a key step in appraising research for use as evidence in practice. Evaluation of threats to internal and external validity makes up a large part of the assessment process for determining the quality of a research study. Creating a valid research study. That was empty. Designing a study that has strong validity or credibility is a challenge, even for experienced researchers. The nature of applied nursing research means human beings are involved, and humans' involvement introduces a level of unpredictability that makes it impossible to predict all threats to validity. However, some threats to validity have the potential to affect almost any study. The conscientious research designer reflects on the most common threats to validity and creates design elements to ensure that the appropriate level of control is achieved. Blinding the researcher to specific elements of the study can help reduce the effects of bias. When the researcher is unaware of the group assignment of subjects and cannot link subjects to data, then the potential for influencing the outcome becomes much more remote. It may be necessary for the researcher to completely remove himself or herself from the setting during data collection to ensure that bias is controlled. Selection effects are controlled most exclusively by the ways subjects are recruited, selected, and assigned to groups. Paying careful attention to the development of inclusion and exclusion criteria ensures that objective rationales are available for leaving some individuals out of the study. Random sampling and random assignment to treatment groups also have the effect of minimizing selection effects. Treatment effects are more difficult to control, particularly for ethical researchers interested in full disclosure. The Hawthorne or placebo effect may be present even in descriptive and correlation studies. The use of control groups or comparison groups can help ensure that any effects from the participation in the study are spread evenly among the subjects. Using sham procedures or comparing two interventions simultaneously can also control for changes brought by treatment effects. Other threats to validity will almost certainly occur during an experiment, no matter how well designed. The researcher has three basic ways to deal with these threats. Eliminate the threat. If a threat emerges that can be neutralized, removal of the threat can enhance validity. For example, a researcher may ask research assistants to collect data if measures or subjects and bias is a concern. By removing himself or herself from data collection, the researcher has eliminated the effect he or she might have had on measuring a subjective trait. Control the threat. If a threat emerges that cannot be eliminated, the researcher can employ methods to control its effects or distribute its effects across all subjects or groups for equality. For example, research to examine the effects of childhood development delays on school success may be affected by socioeconomic status. By matching all the groups on this variable through stratified sampling, the effects of limited resources will be distributed across all the groups equally, neutralizing its effects on the outcome. Account for the threat. If the threat occurs that cannot be eliminated or controlled, then the researcher must account for it in the write-up. All studies have weaknesses and threats to validity. It is up to the reader to determine if the weakness of the study outweighs its strengths. For example, a researcher was studying the attitudes of school nurses towards student violence when the Columbine High School shootings occurred. This historical event dramatically changed the responses of the school nurses. Although nothing could be done about the tragedy or its effects on the research study, the author reported the data as before the incident and after the incident, and noted that it likely had an effect on the outcome. When creating a study, the researcher must balance control of threats to internal validity with the need to maximize external validity. Generalizability is a key issue for research that is to be used as evidence. When research study becomes too highly controlled, its artificial nature limits the applicability of its results to real-world problems, to real-world populations. The researcher must balance each element that strengthens internal validity with a concern to maintain as much external validity as possible. Summary of key concepts. An internal valid research study is one in which there is sufficient evidence to support the claim that the intervention had an effect and that nothing else was responsible for the outcome. Specific conditions must be met to draw valid conclusions about casualty. The intervention is related to the outcome, the intervention preceded the outcome, and the rival explanations have been ruled out. Threats to internal validity can be minimized by collecting data, using an appropriate study design, and controlling bias. Statistical analysis can be used to rule out rival explanations for an outcome through the use of hypothesis testing, minimizing type 1 and type 2 error, considering effect size, and ensuring assumptions are met. When a researcher makes a type 1 error, he or she has concluded that the independent variable exerted an effect when, in fact, it did not. Type 1 error is controlled by careful design and control. A type 2 error has occurred when the intervention had an effect, but the relationship went undetected. Type 2 error is primarily controlled with a strong sampling strategy and achieving an adequate sample size. Many factors can threaten internal validity, including history, maturation, testing, instrumentation, treatment effects, selection effects, and attrition. External validity refers to generalizability of the findings of the study to another population or settings. Threats to external validity includes selection effects, time and history, novelty, and experimenter effects. The researcher must make decisions that balance internal and external validity. As internal validity gets more tightly controlled, it also becomes more artificial and has less applicability to broad populations. Qualitative research is judged by the trustworthiness and credibility of its results. The extension of understanding from qualitative studies comes about through transferability and replication. Strategies to promote the credibility of qualitative research include prolonged contact, verbatim accounts, triangulation, member checking, bracketing, and audit trials. That concludes Week 5 lecture NUR 410. Have a great week. Practice for your midterm exam and review your lectures. I am your professor, Dr. Marion Johnson. Thank you.